Live, a health show brought to you by Dallas Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. It is also sponsored by Zyga Healthcare Group, a leader in providing senior living, home health care, and hospice-related services throughout the entire DFW Metroplex. My name is Dr. Sylvie Simon, and I am joined today hosting this show by Dr. Samir Nangia. You can watch us live on our Facebook page as well, folks. After the show, head on over to our YouTube channel as well. It's called Doc Talk Live, and like, comment, and subscribe to see the great shows we have scheduled in the upcoming weeks. More details can also be found on our website, doctalklive.com. Also, for you healthcare professionals out there who would want to be on the show, please do send us a request through our website or through our Doc Talk Live Facebook page.
Thanks, Dr. Simon. I enjoy being here on Doc Talk Live. I'm excited to be back in the studios. We have a great show for you guys today. Vision is a key aspect of everyday life for people of all ages and can drastically change throughout one's life. Vision can even be an indicator of other medical concerns like diabetes. Therefore, it is very important to make sure that one's eyes are healthy. Today, ladies and gentlemen, we have a great show in ophthalmology, and joining us discussing the topic will be Dr. Megha Agrawal and Dr. Wang. And we'll be talking about all aspects of the eye, so get your questions ready. To be part of the conversation, please call us at 972-235-5555. Again, the number is 972-235-5555. We'll be happy to take your questions live throughout the show. Dr. Agrawal, Dr. Wang, welcome back to Doc Talk Live. Thank you very much for volunteering your time to be part of the show. We're actually lucky we haven't had eye doctors yet this season on Doc Talk, so welcome. Why don't you tell our listeners a little bit about yourselves?
Thanks for having us. This is Dr. Wang. And so, I've been in Dallas for about 8 years now. Before this, I was in California, San Diego. I joined the group North Dallas Eye Associates, where we got a group of 5 guys all across North Dallas area from Plano, Frisco, Flower Mound, Denton, and Louisville. We kind of see the whole gamut of eye issues, so medical and surgical needs that you have, we can take care of all of that.
Hi everyone, my name is Megha Agrawal. I was born in Dallas, went to Hockaday for high school, went away to Stanford for college, but I eventually found my way back to Dallas, where I've been practicing for almost 3 years. My parents are actually both doctors as well. They've been in the DFW area for about 40 years. Like Dr. Wang, I also practice north of Dallas in Denton, Louisville, Frisco, Plano, and Flower Mound at North Dallas Eye Associates. As he said, we practice comprehensive ophthalmology, which includes everything from cataracts, glaucoma, medical retina, even basic eye exams starting from age 10.
Great, let's go ahead and take another caller. Hello, welcome to Doc Talk Live. What is your question?
Hi, she's understandable with me.
I'm sorry, guys. We are live in studio at Doc Talk Live. We have ophthalmologists, Dr. Wang and Dr. Agrawal. Let's take another call. Hi, welcome to Doc Talk. What's your question?
Hi, this is Vijay from Claremont. I had a Lasik done in 2004, and this year I just found out that I had like a really large size, like -4. I was just wondering if I can go back and do Lasik again, and also is there something to worry about because I've been diagnosed with such a big size.
Okay. Dr. Wang, can you take that?
That's a good question, Vijay. So with LASIK, you had a few years ago, and LASIK effects can change through time. And in general, just in addition to changing your prescription, other issues can happen with LASIK, but it really requires a full eye exam just to really better diagnose it.
Vijay, there are many things that can cause a change in your prescription after LASIK. Certainly, sometimes after the procedure, there is something called regression, where your prescription can kind of veer back towards what it used to be. But certainly there are other conditions, cataracts, retinal issues with dryness in the surface of the eye that can absolutely affect your prescription as well. So it's always a good idea to get it checked out so we can know for sure and be able to treat it.
Thank you. Hi, welcome to Doc Talk. Please ask your question.
I have a few questions. I'm a 32-year-old male who has done my Lasik operation with a laser for my eye 10 years ago. But over a period of time, my eyesight has, coming back to the same eyesight that I was having previously, the reason which I did for the Lasik, so it came back to that eyesight number again. So is it recommendable to do a second Lasik, or if I do the second Lasik, when I get old, will there be a problem to my eyes? Like, I can lose my, power permanently or something like that?
Let's ask our experts.
That's another great question, kind of related to the first question too, as far as the effects of LASIK and how long it lasts. And like Dr. Agrawal said too, as you get older, you can develop cataracts, which can also affect the LASIK power. The ability to redo the LASIK, that's called LASIK touch-up, or just a repeat of the LASIK, and that's certainly possible, but it also depends on the parameters of your eyes.
Thank you, Dr. Wang. Just for those who are just tuning in, we live in studio with ophthalmologists here at Doc Talk Live. We're live with Dr. Agrawal and Dr. Wang. Please call the studio with your questions regarding vision, 972-235-5555. Let's take a live caller. Hi, welcome to Doc Talk. What is your question?
I would like to know, do the allergies, with the allergies I'm having a severe itching in the eye, will that affect my eyesight as well as like the eye down to my eyeball, it became very reddish. Is that because of the allergies, or like are there any eye-related problems I'm having?
That's a really good question. Allergies are affecting a lot of people, especially this year. They're saying it's really bad. Allergies certainly can cause a lot of itching of the eyes. They can cause redness, tearing as well. The tearing can cause changes, fluctuations in your vision, especially throughout the day, so that absolutely can affect your eyes. The treatment for allergies tends to be eye drops and antihistamine pills, but actually the eye drops and the pills can also cause dryness of the eyes, and that also can cause redness and blurry vision. So again, it's one of those things that it's good to have your doctor check out to see how much of your vision problems are due to the allergies and how much are due to dryness.
Great, thank you. Hi, welcome to Doc Talk. Please go ahead and ask your question.
Hi, thank you for taking my call. I just have a quick question. How do you avoid the mechanic generous or MD, whatever that?
I'm sorry, ma'am. Let's take another live caller. Hi, welcome to Doc Talk. What's your question?
I have a quick question. Like, what's the difference between glaucoma and the other one? I mean, I'm a diabetic, and my doctor told me like the veins can bleed inside my.
Wow, that's a big question to ask. So you're asking basically two big diseases of the eyes: glaucoma and diabetes. Diabetes as it relates to the retina. So as far as the glaucoma goes, that's damage to the nerve in the back of the eye, oftentimes related to eye pressure. It's a gradual process that can lead to permanent vision loss and even blindness. So if there's any concern about glaucoma, definitely have a doctor and ophthalmologist check it out.
Glaucoma and diabetes tend to be very related as well. They tend to go hand in hand. Unfortunately, glaucoma is not something that many patients can detect themselves. It's silent, it's slow, so that is something that only the ophthalmologist can catch early. Now, with diabetes, that can cause bleeding in the back of the eyes. Certainly, if your sugars are high, that is more likely to occur. Patients may notice floaters, blurry vision. So again, that is something to have your ophthalmologist check out, but there can be more signs of that.
So all of our listeners today who may know someone who's diabetic or they're diabetic themselves, how often should they be getting their eyes checked?
Definitely every year. Once we get a baseline eye exam, depending on the level of the diabetes in the eyes, we will give recommendations. If you have very severe diabetes in the eyes, then we see you sooner, every 4 to 6 months. If you're pretty well controlled, every year is just fine.
Great, let's take a live caller. Hi, welcome to Doc Talk. What is your question?
Hi, thank you for taking my call. I recently got a specs and it's reading as -1. So I just wanted to check, like, if we
get the specs, is this for the lifetime, or is there any possibility of getting the eyesight better and see a need of not having the specs again?
So that's a good question. As far as glasses goes, glasses can change through time due to reasons that we briefly mentioned about diabetes, or if you don't have diabetes, cataracts as you get older. The cornea, the surface of the eye, can also change, and also if you have chronic dry eye, that can actually affect your prescription too. But that's definitely something that may happen, but may not. It's something that we have to watch and have routine eye exams for.
Hi, welcome to Doc Talk. What's your question?
I used to have like fire vision glasses. It's still there, but right now my eyes are like paining. It's killing me. Sometimes I have to just push, like whenever pain in the body. That's how my eyes pain.
Pain in the eyes can be a very common symptom a lot of people experience. One of the most common reasons for it is actually dryness of the eyes, especially if you feel a burning sensation, a scratchy feeling like sand or dirt in the eyes. That can oftentimes be due to dryness. We're experiencing that a lot more these days because we spend a lot of time on the computer, on our phone, reading, driving, watching TV, activities where we're concentrating and not blinking as often. A good place to start is using artificial tears that are over the counter, but certainly that is something we're happy to take a look at and see if there's anything else contributing.
So for those who just joined in, you're listening to Doc Talk Live. The lines are extremely busy. Every line is. So we'll try to get to everyone's question today the best we can. And if we don't, please go on to our Facebook page and put your question there, or our Doc Talk Live website. I know our first caller asked if we could have someone who understands Hindi or Urdu, so I encourage that person to call back during our break, and we'll get her question answered appropriately. So let's head to our next question.
Hi, welcome to Doc Talk. What's your question?
So I've been working for the past 6 months, like on a computer job. So I have a pressure on just one eye for like past 2 months. Is it something I should be worried about? Should I check with a doctor, or like it's because I'm using too much of computer?
That pressure sensation certainly can be related to computer use. In fact, we were talking about dry eyes earlier, and while that typically causes a burning or scratchy feeling or even tearing in the eyes, it can cause headaches and a pressure sensation, especially a sore feeling. That is something that is related to computer use as we are concentrating and we don't blink as often. But of course, we do want to check the eye pressure and make sure that that's not something that's contributing. Inflammation in the eye can also contribute, so it's not something we can know for sure without taking a look.
Hello, this is Doc Talk Live. Wait, what's your question?
My kids are having they are using the glasses, and they are in the fourth. One is in the 9th grade, 5th grade, and the 3rd grade. So they continue to use the glasses. And how do we minimize on their eyesight problems rather than getting bigger and bigger?
That's a great question.
Yeah, that's a good question. As far as children wearing glasses, I think it's important to have the children wear glasses. Think of it kind of like a tool to help them see more clearly. On top of that, you want your kids, especially under the age of 12, to have proper clear vision because it helps their eye nerves develop as well. So it's definitely important to maintain the updated prescription.
Thanks for those who've been tuning in. This is another episode of Doc Talk Live. We've had a great first half to the show. Please again call during the break. The number is 972-235-5555. Again, go on to our Facebook Live and ask your question there if you're at home or not driving. So we're going to be back in 5 minutes, and we look forward to the second half.